Hello dear friends, how are you doing today? I hope you are doing well. Welcome to a new question about dermatology. A 72-year-old woman is diagnosed with several erythematous rough lesions on the back of her hands. A diagnosis of actinic keratosis is made. What is the most appropriate management? A. Reassurance. B. Urgent referral to a dermatologist. C. Topical fluorouracil cream. D. Review in 3 months. And E. Topical betanoate. Okay, here we have a 72-year-old woman coming with the diagnosis of actinic keratosis, and the question is asking about the most appropriate management. If there is no any evidence of progressing of actinic keratosis to squamous cell carcinoma and they are benign, topical fluorouracil cream is the first line of treatment. As we can see here amongst the choices, here we have topical fluorouracil cream, and the answer is a topical fluorouracil cream. Explanation: actinic keratosis. Actinic keratosis, or also called solar keratosis, is a precancerous skin lesion that develops due to long-term sun exposure or ultraviolet radiation. It is very common, especially in fair-skinned individuals and old adults. Clinical features of actinic keratosis: appearance: rough, scaly, sandpaper-like patches or plaques. As we can see in our patient, we can see rough, scaly, sandpaper-like patches or plaques on the dorsal aspects of both of the patient's hands. Color: usually skin-colored reddish or brownish lesions. Size of the lesions: usually small, a few millimeters to 2 centimeters. Location: usually on sun-exposed areas, face, scalp. In bald man, ears, neck, forearm, and hands are the most common sites. Symptoms: often asymptomatic but can cause mild itching, burning, or tenderness. As we can see here, we can see actinic keratosis on the face of this patient. As we can see, the patient has fair skin. Here we can see actinic keratosis lesions, different actinic keratosis lesions on the face of this patient. Here we can see actinic keratosis on the dorsal aspect of hands of this patient, and here we can see different actinic keratosis on the face and of these patients. As we can see, all of these patients have fair skin. Here we can see actinic keratosis on the different parts of the body, and here we can see the lesions under the dermatoscope. Here we can see the progression of the lesions to the squamous cell cancer, and this is important. Importance: actinic keratosis is considered a precursor to squamous cell carcinoma or SCC. Risk of progression to squamous cell carcinoma is around 1 to 10% per lesion, so monitoring and treatment are important. And this is very important point. Risk factors: chronic sun exposure or UV radiation, fair skin, light hair and light eyes, outdoor occupations like farmers, construction workers, old age, and immunosuppression, example transplant patients, are risk factors. Diagnosis of actinic keratosis: clinical examination is usually enough, but dermoscopy or biopsy may be done if malignancy is suspected. Management options include general measures like strict sun protection, sunscreen, has protective clothing are helpful, and regular skin checks is important. Local treatments: cryotherapy with liquid nitrogen is the most common type of treatment. Cortage and electrocautery and laser therapy are also useful. Field therapy for multiple lesions: if the patient is coming with multiple lesions, topical 5-fluorouracil cream, typically at 2 to 3 week course, is helpful. The skin will become red and inflamed sometimes, and topical hydrocortisone is given following fluorouracil to help settle the inflammation. Topical imiquimod trials have shown good efficacy of topical imiquimod. Diclofenac gel may be used for mild actinic keratosis, a moderate efficacy but with much fewer side effects, and photodynamic therapy or PTD is also useful. Here was a short explanation about actinic keratosis presentation and management. We talked about different skin lesions and abnormalities in our YouTube videos. For more information, you can watch them. Thank you for your attention.